Rehab Hospital. He's board certified as an orthopedic surgeon and a physiatrist, which is a rehab doctor. And you will probably never, ever in your lifetime meet someone with both of those credentials. So we are very fortunate to have Dr. Shaw available to teaching myself, my colleagues, and you, our patients, our families. Since this facility's been open, Dr. Shaw has been here with us in 1994. He's presented numerous occasions, both locally and nationally, as well as internationally, about rehabilitation medicine. And most notably, he and his wife Sharon were instrumental in the earlier part of their career in beginning comprehensive rehabilitation medicine in Jeonju, South Korea. And it was there, just last year, he was honored with the newly expanded John Shaw Rehabilitation Center. Now, how many of you can say you have a hospital named after you? It's pretty special. Jeonju. I knew I didn't pronounce that right. So we're really lucky to have him practicing here in Kentuckiana area. He's dedicated his time for many teaching opportunities, including our free stroke clinic, which he'll talk a little bit about. It's helped numerous people in the recovery process. So please help me welcome Dr. Shaw this evening.
Hello? Can you hear that? Okay. Okay, we are so happy all of you came. And stroke is something that, if you're in rehabilitation, is a huge part of what we do. I've had a very special interest, particularly in the spinal cord patient and the hand tetraplegic patient, and now and always in the stroke rehabilitation. So it's been a very good area of disability where I can really blend both rehabilitation and orthopedics and the kinds of things we can do. So we're going to kind of share with you, how many here are families of a stroke patient? Or how many here have had a stroke? Okay, good. So the chances of having a stroke are becoming increasingly a difficult problem. We may want to turn these lights down. Marcia, shall we turn these lights out?
Oh.
Can you see this all right, or shall we? Yeah, I can't see, but that's fine. No, that's fine. That's fine. I can.
Can we hold a flashlight?
No, I can ad lib pretty well. So. Well, unfortunately, as you know, stroke is the leading cause of disability in the United States, and when we were in Korea, actually stroke was the #1 cause of disability. So it's something that is worldwide and becoming much, much worse. It's in the United States, it's the 5th leading cause of death. 70% people who have strokes will have it's a new stroke, and 30% will have a recurrent stroke. And the risk for stroke doubles each decade after age 65. Probably 4 out of 5 families will be affected by someone who has had a stroke, either themselves or a family member. And the African American male has about 2 to 3 times greater risk of stroke, particularly in the younger age. Women have a fewer percentage than male, about 43% strokes in female versus male, and yet a higher percent of those patients die, 61% deaths versus the males. And actually, over almost 30% of strokes occur in people under the age of 28. So just as a reminder to you, you know, there are kind of two different kinds of strokes. One's what we call an ischemic stroke, and one's what we call a hemorrhagic stroke. Most of the time it's an ischemic stroke, which means it's a blood clot. And those are things that it's just amazing, some of the development of what we call neural recovery, or the interventional neural radiology. And the interventional neurologist is kind of a new area of expertise in the neurology, and then it has been an area in neurosurgery and also in radiology. So there's some really very exciting things. I'm not going to go through the details of that, but what I do want to emphasize to you is that how fast it is, how important it is for you to get to the right place. And we talk about this. How many of you have been through our stroke program here? And we have a program here for 3 weeks. We meet 3 times a week, and it's over a 3 week. If you're here 3 weeks, you go through the whole thing. One of the things we emphasize over and over again is to make sure, if you think you're having a stroke, don't even question it. You go to a facility that is a primary stroke center. And we're fortunate that we do have several, but you need to, when the ambulance comes, you need to tell them where you're going to take you. And we recommend University. It's been the first and one of the most leading stroke comprehensive centers in the United States, actually. Baptist Hospital East is a primary stroke center. Jewish Hospital is a primary stroke center. Floyd is it's working on getting qualification for to become a recognized center. So the reason you have about a 25% chance, better chance, if you can go to that stroke center than if you went to another hospital. And so often you go to a rural hospital, community hospital, they then send you on to another hospital, and you may miss that golden time. Now the one thing that's been approved by the FDA is a medication called TPA, which is tissue plasma antigen. And it is, if you get the patient, if it is a clot, and they can prove it's a clot, you have to make sure that it's not a bleed. Then the ideal time is within a 2-hour window. Though most places, we may go as long as 4.5 hours. So it's very important that you can get to a center that does give TPA. Floyd does, even though it's not yet a acute care center. Clark also has neurology, and they do take care of strokes and acute care. But oftentimes those places will send you on to a place like Baptist or Norton's Northeast or University, where if there is a clot, they may be able to interventionally go in there and actually extract that clot. So that's why we really tell you it's important that you get to a center that will give you good immediate care. So if you're talking about somebody who has a stroke, I'm going to take this opportunity right now to let you hear from a very dear patient and friend of mine, Ms. Catherine Michon, who is not only, she had a stroke, she is a leading nurse in nursing education. She is also married even after she had a stroke. So I am going to ask this wonderful person of my acquaintance and who I work with to kind of give you an idea what it's like from a patient standpoint and also as a professional to what it is to experience a stroke and live with it. We gave you some handouts, actually gives you 40 things that this individual who had a stroke, Jill, who wrote this book, A Stroke of Insight. And a lot of these things, it's really good at your leisure to read through that and kind of get a opportunity to hear from a person who had a stroke what it's like. So I'm going to ask Catherine to come up now. Would you like to sit or?